There are a range of modern day breast implants. So here I've got a collection of some of our most common ones that we use. So the first one is an implant that looks like this. This is a typical teardrop implant, which is usually inserted under the muscle, and it imparts a shape of a natural breast. There is a top to the implant and a bottom to the implant. What this is really good for is our patients who have little breast volume to begin with. So patients who come to us saying that they want a better shape, they don't have much of their own, which means that the implant will actually impart most of the shape to their breast. I also find this to be a really good tool for our breast cancer patients who are having reconstruction, because again, the implant will provide most of the shape to their final result. This implant is actually also textured. It means that it's got a slight roughness to the surface, and what that is good for is when it's placed inside the tissues, it creates a Velcro effect, which means it'll stay in place. That's a good thing when it's a certain shape, because we don't want it to rotate. The next type of implant is a round implant. This is also an extremely high quality implant made of silicon. It's round in shape, which means that there's no top or bottom. So if that changes in position in the body, it doesn't actually matter because it's round. This implant's also very commonly used. What it's really good for is possibly imparting a better volume in the cleavage area. It's for our patients who want a bit more fullness in the upper pole of their breast, which is up here. They also do come in different types, so these are both round implants. One slightly different in that it's a little bit firmer, which I feel imparts a bit more of a fuller look, and there's ones that are a little bit softer. The softer ones are quite nice. It's probably a nice compromise between the two types we've talked about. When placed under a muscle, it looks like a breast. It sort of imparts a more natural result. We talk our patients through the pros and cons of all of these implants, but really they're all made of silicon. They're a very high quality implant, which means that should they deteriorate or rupture, they actually won't leak liquid silicon. So if I could cut this implant right now in half, you'll find that it just maintains its position. It's because it's made of silicon that's quite solid. We call it cohesive. It looks a bit like a Turkish delight or a gummy bear on its cross section. What that means is that if it was to have a tear over time, it actually won't change its shape. In fact, most patients won't even know that that's happened. It'll usually be picked up on an ultrasound or an MRI. However, once it does deteriorate, we do encourage our patients to, at some stage, exchange that, because it means that the rest of the shape hasn't changed, and an exchange procedure is much more simpler to perform. All implants usually last for a very long time. We think probably upwards of 20 years, but I do tell my patients after 10 to 15 years, it might be a good idea to have a yearly imaging, like an ultrasound, to check. The round implants that we use at Mohs Plastic Surgery are Motiva implants. They're a very high quality silicone implant, and they have a few unique things about them. Number one, the round shape is composed of a shell and the fill, and it's all in one piece. What that means is if it has a tear, it doesn't leak, like liquid silicone scares that happened a long time ago. These will just stay in position, and in fact, you probably won't even know that there is a little break. We now have a lot of techniques to track implants or record safety data on implants. So there's a small little chip in this implant. What that's really good for is that it records the serial number, the implant detail, such as the size, and also when the implant was inserted and by whom. So should you change countries, cities where you live, you've lost a little card that the surgeon gave you, that's okay, because what that means is that you could be in another part of the world and someone could actually read that microchip and tell you all the information about your implant, which is a really good safety tool. In Australia, we're also fortunate to have now an Australian breast device registry, which your surgeon will place you on. And what that means is that should there be new information about implants, you'll be the first to find out that it's safe and what to do.